Hello guys. So now we shall be discussing in the frontal lobe, right? We have got some areas, right? We have already discussed in the previous lectures about area number 4, right? So today we shall be discussing about area number 6 and 8. Okay. So first of all, let us look at the classification which we have discussed previously. Previously, we discussed that there are some centers called as Brodmann cortical areas of frontal lobe. There we have discussed something called as precentral area and prefrontal area. So in precentral area, we have already discussed about the motor area, that is area number 4 in the previous video. So now we shall be today focusing mainly on the premotor area. What is premotor area? Area 6, 8, 44 and 45. So we shall discuss about 6 and 8. We shall also discuss about 44 as well as 45. Okay. And after that, in the next videos, we will focus on the prefrontal area. So coming to the area number 6, area 6 as well as 8. Okay. So what do you mean? What do you mean by this area 6 and 8? So before we discuss area 6 and 8, first of all, let me draw what are the basic sulci we have got. Okay. So if you haven't watched my previous lectures, so please do watch those lectures where I have discussed about sulci and gyri in detail. So here I might not cover the entire sulci and gyri here, but I'll cover few of them for those who are watching this video for the first time, right? So there are two important surfaces which I have to draw. For example, this is your cerebral cortex. Okay. Now in the cerebral cortex, this side and this side, both these sides are called as supralateral surface. Okay. So this is your right cerebral hemisphere. This is your left cerebral hemisphere. Both of them join together here. Supralateral surface here. This is one supralateral surface. So when I'm dividing them, both of them, this area is called as a medial surface. Okay. So I will draw one picture of the supralateral surface, another picture of the medial surface. So coming to the supralateral area. So this is your cerebral cortex on the supralateral surface. Okay, cerebral cortex on your supralateral surface. In the center here you have got a sulcus. This sulcus in the center is called as your central sulcus. Okay. Now in front of the central sulcus, if I'm drawing a line over here, this line over here is in front. In front is called precentral. So this sulcus over here is called as precentral sulcus. Next, if I'm drawing a line at the back, this is called as a postcentral sulcus. So one is called as the central sulcus. One is called as the central sulcus, right? So this sulcus located behind the central. So you call it as a postcentral sulcus. Okay. One located in the front. You call this as the precentral sulcus. You call this as a precentral sulcus. So central sulcus, postcentral sulcus and precentral sulcus. Now in front of the precentral sulcus, if this entire lobe is your frontal lobe, right? Now within this frontal lobe, for example, if I'm drawing two important lines like this, so what will be these two important lines called as? One is called as superior frontal sulcus, another one is called as your inferior frontal sulcus. Okay, so this one over here is called as your superior frontal sulcus, and this one over here is called as your inferior frontal sulcus. So superior and inferior frontal sulcus. Next important thing is that if you see a sulcus which I'm drawing like this laterally, this is called as lateral sulcus, right? But actually this lateral sulcus has got three important branches. Branches are also called as rami. So one branch goes anteriorly forward. This is called as anterior horizontal branch. And another branch goes up like this. This is called as ascending branch. And next another branch goes posteriorly, I mean back in this way. This is called as a posterior branch. So how many branches we have got? One is called as the anterior horizontal rami, ascending rami, and next one is called as your posterior rami. Last important thing you need to know here is that this lobe over here is this pole over here is called as your frontal pole. This pole over here is called as your temporal pole, and this one on the back is called as your occipital pole. So there are three poles over here: frontal pole, temporal pole, as well as occipital pole, right? Now, next important thing you need to know that, for example, okay, regarding this picture, this is the important thing you need to know. So here there are three important areas. Okay, what are those three important areas? For example, you see this gap over here. This is one area, and you can also see one more gap over here. This is one more area, and you can also see one more gap on the back. So what are these important three areas which you need to know over here? See, for example, let me put the same pictures over here. One with the yellow, right? And one is this baby pink, and next you have got this color. So what are these three areas? One area over here is called as your pars orbitalis. Pars orbitalis. The next layer you have got is the pars triangularis. Triangularis. And the third area you have got is pars opercularis. Pars opercularis. Okay. So this yellow color area over here is pars orbitalis. Next you have got is pars triangularis, and the last one is called as your pars opercularis. Now here, where is your area number 6 and where is your area number 8? Now remember one thing, that this area which I am highlighting in front of the central sulcus, this green color area which I am highlighting in front of the central sulcus, this area is called as the precentral area. Yes or no? So in the previous discussion we discussed that there is an area called as precentral area. Precentral area is in front of the central sulcus. So in precentral area we have got motor area, we have got premotor area. So where is motor area? This green highlight whatever I have done is a motor area, and this yellow highlight whatever I am doing right now is called as your premotor area. Okay, so this one over here is called as your motor, and this one over here is called as your premotor. So together motor and premotor together, you call this area as what? You call this area as precentral area. You call this area as precentral area. So within this motor area, you have got area number 4. If you have watched my previous lecture, there you understood that area number 4 is located in the motor area. In the premotor area, you have got area number 6 and 8. Okay. See, this entire yellow color shading whatever I have done is 6 and 8 only. It is not that the upper one is 6 and 8, the middle one is something different and the lower one is the other thing. No. This entire yellow shade is just 6 and 8. Okay. So if I ask you, where is this area 6 and where is this area 8? What will you tell? Area 6 and 8 are located in the C. By the way, if you are watching this video for the first time, just know this thing, that this area is called as superior frontal gyrus. Gyrus, not sulcus. Superior frontal gyrus. This area is called as inferior frontal gyrus, and the area which is on the top is called as a superior frontal gyrus. The area which is in the middle is called as middle frontal gyrus. The area which is located below is called as the inferior frontal gyrus. Okay. After discussing these three gyrus, now you have to know one thing, that this is the anterior part of these three gyruses. This is the middle part of these three gyrus, and this is the posterior part of these three gyrus. Now tell me, area 6 and 8 is located in the anterior part of these frontal gyrus or in the posterior part or in the middle part? Obviously that yellow shade I have done is in the posterior part of superior, middle and inferior frontal gyrus. So area 6 and 8 are located in the posterior part of frontal gyrus. Frontal gyrus, namely you have got superior frontal gyrus, you have got middle frontal gyrus, you have got inferior frontal gyrus. Three important gyrus. Okay. Now, are the area 6 and 8 present only here? Aren't they present on the other side also? Right. Now I will draw a picture like this. So this was the superior lateral surface which you saw right now, right? This is this surface. Now what I will do is that I will separate the cerebral hemispheres and I will show you the surface here. That is a medial surface. So in the medial surface, right, if this is the medial surface, here this structure which I am drawing right now is called as your corpus callosum. This structure over here is called as your corpus callosum. Now, another important thing is that this central sulcus is there. This central sulcus will continue backside. Backside in the sense, see, this is a central sulcus continuing towards the medial side. So it is continuing towards the medial side like this as a central sulcus only, right? Next, here you have got one more sulcus that is going like this all the way and touching the cortex. This sulcus over here is called as your cingulate sulcus. This is called as your cingulate sulcus. Okay. Now I don't want to discuss any more sulci over here. What you need to know is that this is that yellow color area. You see, this is that yellow color area, and this yellow color area is having what? Area number 6 and 8. You see, area number 6 and 8 is present majorly on the superolateral surface, and a little bit is also continuing to the medial surface. So now let us see what are the functions of this area 6 as well as area 8. Now coming to the functions of area 6 and area 8, which is located in the motor or premotor. It is located in the premotor area. Premotor area. Okay. Now, what does it do? What does it do is that it is responsible for the coordination of voluntary movements. It is responsible for the coordination of voluntary movements. Now, what do you mean by it is responsible for the coordination of voluntary movements? For example, let us say if I have to lift this remote, right? What will I do? I will lift this remote. This is just called as a voluntary movement. Okay, this is called as a voluntary movement. For example, let us say there is a cup of tea in front of me, right? If I have to lift the cup, I will lift the cup. This is called as a voluntary movement. What is called coordination of voluntary movement? Exactly, I have to lift it up, right? And then I have to take this cup of tea towards my mouth, right? So if the coordination is disturbed, if area 6 and area 8 is not working within my body, then if this coordination will be disturbed, if this coordination is disturbed, I can lift the cup of tea, but there is no proper coordination. Instead of putting it towards my mouth, I might overshoot it to the left, I might overshoot to the right. You're getting it? Second important thing, I close my eyes, you tell to take my finger and put it on the nose, right? So I'll put it. Normally I'm lifting it and then I'm putting it. But this coordination exactly, if it has to happen, then area 6 and 8 should work. If not, what will happen? You can overshoot your finger and you can injure your eyeball like this. Okay. So that is what is called as coordination of movements. One is called as movements. Another one is called as coordinating these movements. So this coordination of movements is done by area 6 as well as area 8. Next, this particular area 6 and 8 is also associated with the function of extrapyramidal system. It is also associated with the functions of extrapyramidal system. Associated with the functions of extrapyramidal system. What do you mean by extrapyramidal system, and what do you mean by associated with the functions of extrapyramidal system? First of all, you need to know that right now in all of us, we have got sensory system through which we receive the sensations. We even have got motor system with the help of which I am able to talk, I am able to walk, right, lift up the objects, do my daily activities. So that motor system, whatever is present in your body, is widely divided into two important systems, right? So this motor function or motor system is divided into two important parts. One is called as pyramidal system. And the other one is called as extrapyramidal system. Okay, so one is called as your pyramidal system, the other one is called as your extrapyramidal system. What is the use of this pyramidal system? Pyramidal system is just useful for the voluntary movements in your body. Is useful for the voluntary movements of your body. Then what is the use of this extrapyramidal system? Extrapyramidal system will modify the pyramidal system. Extrapyramidal system will modify the pyramidal system. What do you mean by this? What do you mean by extrapyramidal system will modify the pyramidal system? For example, let us say that this is your house. Okay, so let us say that this is your house over here. Right, now in this house, this is your house, and let us say this is the road. This is the road. Let us say the house, from the house to the road, it would take around 1 kilometer, or let us say 2 kilometers. Okay, and this is the place where your school bus comes all the time. So this is your school bus, let us say. So this is the school bus over here. Now, what did I tell you? It would take around how much time? It would take around it is around 1 to 2 kilometers to reach to the road where you get your school bus. Now, will you start 5 minutes before the school bus arrives, or will you start 30 minutes before the school bus arrives? Or most probably you would start, let us say, 15 minutes before the school bus arrives, right? You will start walking and go to the place where the bus comes. Let us say you are late, right? Within 5 minutes, the school bus is about to come. Now, when the school bus is about to come, now will you slowly walk and go there? Will you reach within 5 minutes the 2 kilometers distance? No. You have to run. Right? If you have to run, right, what system is needed here? Voluntary movements are needed. It means if you have to run there to reach on time, your pyramidal system should work, right? And to activate this pyramidal system, who is working? Extrapyramidal system. That is the reason why I have written extrapyramidal system is modifying the pyramidal system. So extrapyramidal system will activate your pyramidal system so that you run fast there and then take the bus. But if you are staying nearer to the place where the bus comes, just nearer to that, okay, from the window, you can literally look at the road where the bus comes all the time, right? Now, will you rush there 30 minutes before? No, just 5 minutes before. So during that time, will you run or will you just walk? You will just walk. In that condition, what will happen is that your extrapyramidal system will suppress your pyramidal system, telling that you need not to hurry up. You can just walk. You can just have small movements, small voluntary movements, and then go pick up the bus. Okay. So this is the function of extrapyramidal system over here. Okay. So this is one of the very important thing which you need to know. So this extrapyramidal system activity is done by what? Area 6 and area 8. So area 6 and 8 is associated with your extrapyramidal area. Next important thing I want to tell you here is that, let me draw this picture fastly. This is your lateral sulcus, I told you. And very fastly, this is your central sulcus. In front of the central sulcus, this is your precentral sulcus, and this line is your postcentral sulcus. And I have already told you that this area is called as area number 4. In front of the area number 4, this area is called as area number 6 and 8. And obviously, not to forget that this is your superior frontal sulcus, inferior frontal sulcus. So where is your area 6 and 8 located? Your area 6 and 8 are located in the posterior part of the frontal gyrus. Now, another important function over here is that you see the posterior part of the middle frontal gyrus. See, this is your superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus, right? So if you look very carefully, this is the middle part of the posterior part of the middle frontal gyrus. So this posterior part of the middle frontal gyrus, you see this area. What is the name of this area? Still 6 and 8 only. But this area has got another name also. The name of this area is frontal eye field. Okay. This area is called as frontal eye field. Frontal eye field. So this is the name that is given to this area. So if I ask you what is frontal eye field, you have to tell where is your frontal eye field is located. If there is an MCQ, you have to answer it as it is located in the posterior end of middle frontal gyrus. Still, what is the name of the area? Area 6, area 8. Okay. Even if I tell posterior end of superior frontal gyrus, 6 and 8. Posterior end of inferior frontal gyrus, 6 and 8. So what is the function of this frontal eye field? Frontal eye field, eye in the sense it is responsible for your eye movements. It is responsible for your eye movements. So what are the two types of eye movements you know? One is called as convergence, another one is called as conjugate deviation of eye. One is called as convergence, another one is called as, I will explain what is this. Another one is called as conjugate deviation of the eye. Conjugate deviation of eye. Now, what do you mean by convergence? What do you mean by convergence is that, first of all, before I discuss convergence, you have to know one very important thing. Let us say this is your eye, right? Now, if this is your eye over here, right? Now, let us say that you have got muscles surrounding the eye. So, one muscle which I'm drawing here, this muscle over here is called as medial rectus. So, medial rectus is located on both the sides. And next you have got muscle here also. These two muscles are called as lateral rectus muscles. So, this is your lateral rectus, this is your medial rectus, and this is your medial rectus. For example, if I contract my medial rectus, what will happen? Both the eyeballs are looking towards my nose. They are convergent. If I contract the lateral rectus, what is happening? My eyeball is looking right like this, right? Now, what I'm trying to tell you is that, for example, what do you mean by convergence? What do you mean by conjugate deviation of the eye? Let us say take this remote. Now, if take any object, put the object closer to your face. Now, and concentrate on the object. Okay, fix your eyes onto the object and take the object closer to your nose. So you look at my eyes now. When I'm taking the object closer to the nose, you see both my eyeballs are convergent or divergent. Both the eyeballs are convergent. Once again, you see both the eyeballs are convergent. So this is called as convergence. So what is happening here? Both my medial rectus muscles are contracting so that both my eyeballs are pulled medially, right? Both the eyeballs are pulled medially. Second important thing, what is conjugate deviation of eyes? What do you mean by conjugate deviation of eyes is that, for example, if I put an object, let us say, to my left, and if I tell you to look at the object, I will look at the object like this. Now, when I'm looking at the object, both my eyeballs are looking there, but there are two different muscles that are contracting. See, if this eyeball has to look there, the muscle that is present here, what is that? Lateral rectus has to contract. And if this eyeball has to look there, then medial rectus has to contract. You see, the lateral rectus and medial rectus together, they have contracted to look conjugately, togetherly. Both the eyeballs are deviating in conjugation to the left side. When I'm moving the object to the right side, then the right lateral rectus of the right eye, then the medial rectus of the left eye, both of them are contracting to equally focus my sight on to another object like this, right? So this is called conjugate deviation of your eyes. Okay, so these movements, conjugate deviation of your eyes and convergence, are done by your 6 and 8. Okay, so these are also done by your 6 and 8, right? So first of all, you might get a doubt whenever you are looking at an object. Okay, I'm putting the object over here. Now I'm looking at that. Now how is my 6 and 8 causing contraction of my eyeballs? 6 and 8 center is located in your brain, right? Now how is this 6 and 8 center is causing contraction of my medial rectus? It is causing contraction of my lateral rectus. How is that possible? Is that this is how it is done. So much more detailed thing you'll study in physiology, but I'll just brief up the things, okay? Let us say that this area which you can see over here, this yellow color area, right? So this was your 6 and 8. This is your 6 and 8. And down over here, you have got your midbrain. This is your pons. This is your medulla oblongata. Over here. Now, here within the midbrain, you have got two important nuclei. Okay. One is the nucleus of the third cranial nerve. What do you mean by the nucleus of the third cranial nerve? That is your oculomotor nerve. And here you have got the nucleus of the fourth cranial nerve. That is your trochlear nerve. Next, down here, you have got another nucleus. This is the nucleus of your sixth cranial nerve. That is your abducens nerve. Now, if I have to visualize something, right? What is the cortex that is responsible for vision? That is your occipital cortex, right? So whenever I look at something, directly those images are stored within my occipital cortex. Now, from this occipital cortex, what is happening here is that you see there are a group of fibers that are going, and these group of fibers are relying on which cortex here? They are relying on the area of 6 and 8, right? So what will happen? They will relay on this area like this, 6 and 8. Now from these fibers which are going like this from the occipital cortex to the area 6 and 8, or I can also call it as a frontal eye field, right? So these fibers are called as association fibers. Now these association fibers will relay on some other fibers like, and these fibers, what will happen? You see these fibers, they are coming down. Okay, so these bundle of fibers, they are coming down. What they do? These fibers, they activate third pair of cranial nerve. These fibers activate fourth pair of cranial nerve. These fibers even go into the pons and activate your sixth pair of cranial nerve. So what is your third pair of cranial nerve over here called as? This is called as your trochlear nerve. Fourth pair of cranial nerve over here is called as your, third pair of cranial nerve is called as your oculomotor nerve. Oculomotor nerve, and this is called as your trochlear nerve. Trochlear, the fourth is called trochlear, and the sixth is called as abducens. So abducens. So when these structures are contracted, when area number 6 and 8 is working well, it will send impulses down to oculomotor, trochlear and abducens and activate them. As these oculomotor, trochlear and abducens are innervating your eyeball, right, are innervating the lateral rectus, medial rectus and all these rectus muscles. So they will contract those rectus muscles, and that is how you are able to deviate your eyeballs, right? So if let us go little bit detailed on these things. Let us say that this is your eyeball. Okay, so let us say this is your eyeball, and let us also tell that this is the nose like this. Now what I'm telling you is that here on the top you have got a muscle, you have got a muscle down, you have got a muscle here, you have got a muscle here. And not only that, you even have got one muscle obliquely like that and obliquely down. Okay, so this muscle is straight. Any straight muscle is called as rectus, which is located on the top. This is called as superior rectus muscle. Okay, down here you have got inferior rectus muscle. Inferior rectus. Next, towards the nose, towards the midline, you have got is medial rectus, and here you have got is lateral rectus. Okay, then what is the muscle on the top and down? So this muscle over here is called as superior oblique muscle, and this muscle over here is called as your inferior oblique muscle. I'm not going to tell you the actions of each and every muscle right now, but what I'm trying to tell you is that you see the oculomotor, trochlear and abducens are the nerves that supply, are the nuclei from where the nerves they supply your rectus muscles. So how is the supply that is going on is, just remember this formula, SO4 LR6R3. What do you mean by SO4? SO4 in the sense superior oblique is supplied by fourth pair of cranial nerve. So superior oblique is supplied by fourth pair. What is the fourth pair of cranial nerve? Fourth pair of cranial nerve is called as your trochlear nerve. Next, LR6 in the sense lateral rectus. Lateral rectus is supplied by sixth pair of cranial nerve, which is your abducens nerve. R3 in the sense the remaining, the rest of them are supplied by your third pair of cranial nerve, that is your oculomotor nerve. Okay, so these are the three important things which you need to know. So who is ordering these three cranial nerve nuclei to supply and contract? That is your area 6 and 8. I hope now you understood what is frontal eye field, what is area 6 and 8 doing over here, right? Now, after discussing this area 6 and 8, the next important area we have to discuss over here, right? So let me make a fresh picture. Right. So here I have already told you one very important thing. I've already told you that this is your lateral rectus. This is your lateral sulcus. Now this lateral sulcus has got some parts. So this is called as the anterior horizontal part. This is called as the part which is above, that is the ascending part, ascending ramus, and this part is your horizontal, or you can also call it as a posterior ramus. Okay. Now between not between, below this anterior horizontal ramus, here you have got this area. You see, this area over here is called as pars orbitalis. Okay. Next, you have got this area over here, a triangular area. You see, this triangular area over here is called as pars triangularis. Next, this area, green color area, you can see this green color area, you call it as pars opercularis. So let me write down these areas over here. So you have got this yellow color area, you have got this baby pink, and then you've got this green. So these areas, one area is called as your pars orbitalis. Next you have got is a pars triangularis, and third important thing you have got is a pars opercularis. So these are the three important areas, right? Now in these three important areas, what did I tell you? I told you specifically that this area is 44, this area is 45. So this is 44. So this area is your 44, Brodmann area 44, and this area is Brodmann area 45. Now these two areas together, you call it as Brocas areas. These two areas together you call it as Brocas areas. What is Brocas area? Brocas area is nothing but called as your motor speech area. Motor speech area. Now what is motor speech area? What is motor speech area in the sense? Normally you have speech. What do you mean by speech, guys? Speech has got how many components? All of you know speech in the sense speaking. Speaking is done by the muscles in the sense motor. So you might tell only motor component. Yes, speech is consisting of motor component. Along with motor component, you have also got one more component, that is called as sensory component. Sensory component. So what do you mean by motor component and what do you mean by sensory component? For example, let us say if someone has come to me and asked, how are you doing? A simple statement, how are you doing? How are you doing today? Right? Now, only if I understand their question, I will be able to speak. Now, the level of understanding, if someone is, if for example, let us say the sensory component of the speech within my body, the sensory component of the speech is damaged. If it is damaged, if you are asking me, how are you doing today? I can listen to you. How I can listen to you? Because my auditory region is working well. So I can listen what you told, but I cannot understand what you told. You're getting? Listening and understanding are two different things. Why am I able to listen what you told? You see, I'm doing my work. You just came and you asked, let us say, how are you doing today? So I can listen to you, so I'll immediately look at you. But I don't understand what you have just uttered, what you have just spoken. Why? Because my sensory component is damaged. Now, if my sensory component is working well and motor component is damaged, so you are asking me, how are you doing today? I understood, but I cannot tell it to you that I'm doing well or I'm doing bad, right? I cannot tell it to you. Why? Because my motor component is damaged. And that motor component is nothing but called as your Brocas area. So for example, in a patient, if 44 is damaged, 45 is damaged, it means the patient will have a condition called as Brocas aphasia. It means he is unable to talk. Talking is done by the muscles in the sense the motor, right? That's why we have written here is a motor speech area. So patient will not be able to talk, and that is the reason why I call it as Brocas aphasia. So in Brocas aphasia, patient will have problem in speech production. Speech production. He won't be able to speak, right? Why? Because this Brocas area is controlling your tongue, it controls your lips, it controls your mouth, it controls your palate. Every fine movement control is done by this Brocas area. So that is the reason why if there is a damage to this Broca's area, patient will have problem with the speech protection, right? So then will the patient understand whatever I told? Yes, patient will absolutely understand whatever you have spoke, but he won't be able to articulate it. I mean, he won't be able to produce the speech. Okay. So that area is called as your area 44 as well as area 45. Okay. Right. So this is all about area 6 and 8, which you have to know, right? So what did we discuss previously, guys? We discussed previously in the previous lectures one very important. What is that important thing? We discussed that there are two important areas. One is called precentral area. Precentral area is having what? It is having motor area. It is having premotor area. In motor area, area number 4, the functions where it is present I have discussed. Next, when it comes to area 6 and 8, also what are the functions I have discussed. What is area 44, 45 also I have discussed. Now I will discuss about what is a prefrontal area. First of all, where is this prefrontal area present? Now, just look at this picture over here. Right. So this is your lateral sulcus, and let us say that this is your central sulcus, and in front you have got is a precentral sulcus, back you have got is a postcentral sulcus, and here you have got the superior frontal sulcus, inferior frontal sulcus, right? This thing we have already discussed. What is the thing we have already discussed? We discussed that this area is called as area number 4, right? Next, we have discussed this yellow color area as area number 6 and 8, right? Now I'm telling you that you see this particular area like this, right? You see this particular area over here is called as prefrontal area. It is completely in the front, so you call this area over here as your prefrontal area. Prefrontal area. Okay, so what are the numbers of the area prefrontal area? One is 23, 24 and 31. 23, 24 and 31. So these three are the prefrontal areas. Okay, now what is the use of this prefrontal area? I will tell you that, but before that you should know that is this prefrontal area also located on the medial side? Yes, this prefrontal area is mainly located on the medial side only. Okay, so now I will draw a picture behind this. It means the medial surface like this. Okay, so medial surface, when you look, so this is your medial surface, and medial surface has got, what is this? This is called as your corpus callosum. So this structure over here is called as your corpus callosum. Okay, and here from the previous lectures, this is your central sulcus, and this structure which I'm drawing like this is called as your cingulate gyrus. Now, one very important thing you have to know, that where is this prefrontal area? See, here this is the medial surface, right? This is area number 31. Okay, area number 31. Next, this is called as area number 23, and this is called as area number 24. It means this entire area is your prefrontal area. Okay, now what is the use of this prefrontal area? Prefrontal area has got some very important things. For example, this prefrontal area controls the emotions. Second important thing, prefrontal area is also responsible for mental concentration. Third important thing is prefrontal area is also responsible for attention, right? So this area is very well developed. I think this area is very well developed in girls, right? So they crave for attention. So this area is responsible for attention. Okay? Now, fourth important thing is behavior. You know, the normal social behavior, whatever you do, right? So that is a behavior. So these are some of the important things. So controlling the emotions, mental concentration, attention, as well as behavior. So most of the medico-legal problems, most of the, let us say, the murders, whatever it might be, the thefts, whatever it might be, the fights, whatever it might be, it will happen because of if there is any kind of disorder to this area, right? So in that case, normally also normal normal person with normal centers, he can also have uncontrolled emotions, he can have loss of mental concentration, attention disorder, and vulgar behavior and all. But even patients who have a problem in this prefrontal area will really have issues with these four important things. Okay, so this is one of the very important thing which you need to know. Let us, what we do is that let us just revise the things we have just spoke. So we started on discussing the area 6 and 8, right? Area 6 and 8 is located in front of the precentral sulcus, right? So area 6 and 8 is nothing but called as the posterior part of the frontal gyrus, right? So, and next down here, 6 and 8, you see the posterior part of the frontal gyrus, I mean superior medial and inferior frontal gyrus. What are the functions? You also call these areas premotor area. What are the functions? It is responsible for the coordination of voluntary movements. Coordination is a very important term. Next, it is associated with the functions of extrapyramidal system. Extrapyramidal system in the sense, motor system is divided into two. One is called as a pyramidal system, another one is called as a extrapyramidal system. Pyramidal system is responsible for the voluntary movements, whereas extrapyramidal system modifies the voluntary movements. So I told you what is the example over here. And next here, the middle posterior part of the middle frontal gyrus is called as a frontal eye field. This is a very important thing. They can ask you here, area 6 and 8. It has got two eye movements. One is called as convergence, conjugate, deviation of eyes. Whatever it is, these are done by what? These are done by fourth, sixth as well as third pair of cranial nerve. And not to forget that these branches over here are, these bundle of fibers over here are called as association fibers. Association fibers. Second important thing we have discussed is regarding the 44 and 45. 44 is pars triangularis, 45 is pars opercularis. Both of them together you call it as a Broca's area, which is also a motor speech area, right? So problem here causes Broca's aphasia. So these are some of the important things which we discussed regarding area 6-8 as well as 44-45. Okay, thank you so much for watching my video. Goodbye.